Welcome to Be Confident Coaching Center. In my previous class, I had discussed anemia, reading question from 1 to 6. And in that question, you had to darken the correct answer. Whereas today, I'm going to teach you how to do questions from 7th onwards. From 7th onwards, you will have to write at least one word or a phrase. First, you will have to read the question prior to reading the paragraph and underline the keywords. So let's see what are the keywords in this particular question. What should vegan patient with vitamin deficiency anemia be encouraged to add to their diets? So here the keywords are vegan patient or vegetarian patient, deficiency and add to. Add to means include in their diet. So what all should be included? Now let's come to the answer. What all should be included by vegan patients? So the word vegan is being mentioned in this particular paragraph, that is paragraph D, where the treatment plan is being mentioned. So as I mentioned in my previous class, you will have to underline the first sentence of each paragraph because in that particular paragraph matter consists of the initial sentence or the beginning sentence. So here the treatment plan is given in paragraph D. So what should be included? That means the treatment. So for vegan patient, fortified food should be included in their diet, and so the seventh answer is fortified food. Now let's move to the eighth question. If there's a decreased number of young red blood cell, what type of anemia is being dealt with? So in paragraph B, classification of anemia is being mentioned. So let's move to paragraph B. What type of anemia is being dealt with? So if there's a if the size of the red blood cell is normal, then normocytic anemia, and let's move to the diagram if we can come across the answer. So normocytic anemia is being subdivided into normal and high reticulites. We are talking here about the decrease in number of reticulites. So the answer will be low reticulites. It is being clearly mentioned in the diagram. It's not a direct answer. It's an indirect answer. So when the statement relating to high reticulites is being mentioned, the opposite of high reticulites is the low reticulites. So the answer is low reticulites. Now let's move to the ninth question. How will a patient's breathing sound when experiencing a significant reduction of oxygen in the body's tissues? So what will be the sound? So you will have to the answer should be relating to the sound of the breathing. Question number 9. So let's check in which paragraph it will be mentioned regarding the sound of breathing. Different types of anemia or classification of anemia. Where should it be mentioned? Regarding the breathing sound. Treatment plan? No, it should not be mentioned in the treatment plan. Then, whether it should be mentioned in different causes of anemia? No, nothing related to the causes are being stated. Then, classification of anemia or yes, symptoms of anemia. Here the word symptoms of anemia is given in paragraph A. and it is clearly mentioned regarding the difficulty or labored breathing. So answer is labored breathing. Answer number is labored breathing. Now let's move to the next question. Question number 10. We have done till question number 9. Now let's move to the next question, that is question number 10. The answer of ninth question was labored breathing. A male with anemia must have less than what percentage of red blood cells? So causes of anemia is being asked. So it's mentioned in paragraph C. Here the keywords are male, percentage. So the answer will be in numerical form. So let's go to the text. Here different causes of anemia is mentioned in paragraph C. Let's move downward. Here hematocrit, the male is less than 45% red blood cell. So the red blood cell in male is less than 45%. Answer is 45%. Next, now move to the next question, that is the 11th one. What's an increase in the number of reticulites an indication of? So what does the increase in reticulites known as? Let's move to the paragraph dealing with reticulites. So this paragraph deals with reticulites, and let's find if there's any word like indication or any synonyms of indication. Yes, I have found it. Here the term indication, the same word is being given, indication. So what does it indicate? It indicates bone marrow working properly. So here the question is, what does it indicate? What is this indication of? So when the preposition of is being used, you will have to say bone marrow working properly, and we shouldn't use is, because the word is not appropriate. What is an increase in the number of reticulites an indication of? It's an indication of bone marrow working properly. So your answer should be related to the question, and it should seem like an answer. You should not include unnecessary preposition or any auxiliary verb as such. It should seem appropriate. What reduces the amount of red blood cell in some patients? So in some patient, it's clearly specified some patient, not every patient. So it might be children, men, women, or any other type of patient relating to any deficiency. So let's check. What reduces the amount of red blood cell in some patients? It might be male, female, or children. So let's see. The causes of anemia was mentioned in paragraph C. So we will find the answer in paragraph C. Different causes of anemia. Let's move downward. Yes. What of the patient should be considered in addition to laboratory studies? It should be in paragraph C. Yes, anything related, yes, etiologies, it has been given. The same term has been used, etiology, and just prior to that, unique features of the patient, unique features, laboratory studies and unique features. So the answer of 20th question is unique features. I believe you have understood the way I have taught, the method I have used to identify each paragraph. Please like, share and subscribe so that maximum number of students can benefit from it. Thank you for now. If you have any doubt, you can ask me